Good morning, everyone. Myself, Nitish, Arya, and Haran are here to present on a topic smart healthcare and monitoring. Now, let's move on to the first slide. So, we are here to present on the topic smart healthcare and monitoring. This system uses IoT devices, sensors, and cloud computing with artificial intelligence to continuously monitor a patient's health. It helps doctors and caregivers receive real time health information, enabling faster diagnosis and better treatment decision. Now, let's move on to the slide 2 agenda. In this presentation, we will understand what smart healthcare monitoring means and why it is important. Then, we will discuss the core technologies involved, including sensors and cloud systems. Next, we will look at healthcare applications, benefits, challenges, and finally, the future scope of smart healthcare monitoring. Now, let's move on to the slide 3. So, what is basically smart healthcare monitoring? Smart healthcare monitoring refers to the continuous tracking of patients' health using sensors, wearables, and connected technologies. Unlike traditional healthcare checkups, which happens occasionally, smart monitoring provides a continuous view of patient's condition. This allows early detection of health issues, personalized treatment, and remote healthcare support. So let's move on to slide 4. So why it basically matters. This technology is important because it helps detect health monitoring problems before they become severe. It improves chronic diseases management for conditions such as diabetes and heart diseases. It also increases the patient safety and engagement by reducing unnecessary hospital visits while keeping patients connected to the healthcare providers.
System architecture. The smart healthcare monitoring system follows a three-stage architecture. First, sensors collect vital health data such as heart rate and oxygen levels. Next, a gateway transfers this data to cloud servers where AI algorithm analyze it. Finally, clinicians access the results through dashboards, helping them make quick and informed medical decisions. Moving on to the next slide. Key monitoring devices. Several devices are used in smart healthcare systems. Smart watches and fitness brands continuously monitor daily activity and heart rate. ECG, SpO2, and blood pressure sensors provide medical grade health information. Continuous glucose monitors help diabetic patients manage their condition more effectively. Smart home devices also extend monitoring beyond hospitals. Applications in healthcare. Smart healthcare monitoring has many practical applications. Cardiac monitoring system can detect abnormal heart rhythms early. Continuous glucose monitoring helps manage diabetes. Fall detection systems improve safety for elderly individuals. Remote recovery monitoring supports patients after surgery, reducing the need for frequent hospital visits. Role of artificial intelligence. Artificial intelligence plays a major role in modern healthcare monitoring. AI continuously analyzes patient data and identifies abnormal trends that may indicate health risks. It reduces false alarms, improves signal quality, predicts potential emergencies, and provides valuable decision support for doctors. This leads to faster and more accurate clinical responses.
So, data privacy and security. Since smart healthcare system collects sensitive patient information, privacy and security are very important. Patient record must be protected when they are stored and when they are transferred. Encryption can help protect information from unauthorized access. Secure authentication is also important so that only authorized healthcare professionals can access patient information. There are also risks related to device failures. If a monitoring device stops working, important healthcare information may not be available. Healthcare system must also follow appropriate compliance and ethical requirement. Therefore, security should be included from the beginning of the system design. The main idea is secure by design. Patient trust does not only depends on accurate monitoring but also on protecting the information. So next, although smart healthcare has many advantages, there are also some challenges. The first challenge is cost. Sensor device, cloud infrastructure, and other equipment can require significant investment. The second challenge is inoperability. The different healthcare device and platform needs to communicate with each other properly. Another challenge is limited internet connectivity, especially in some rural areas. User training and adoption are so important. Even a good technology will using it. Looking at the future, we expect more advanced wearables and implantable sensors. AI diagnosis will become more capable. Telemedicine and home healthcare can also become more connected. Overall, healthcare is moving towards continuous and predictive monitoring. And conclusion, to conclude, smart healthcare monitoring uses connected device sensors, cloud systems, and AI to continuously monitor patient health. It can help healthcare professionals identify problems much earlier to provide more predictive care. Technology can also improve accessibility by allowing patients to be monitored outside the hospital. AI can make the system more intelligent by identifying important patterns in health data. However, security, cost, connectivity, and user adoption must be considered for the successful implementation of the technology. In the future, healthcare is expected to be more and more connected, continuous, and predictive. So, smart healthcare monitoring represents a shift from reactive treatment to predictive care. Thank you for listening to our presentation.